Good morning, everyone. You're listening to Caregiver Crossing. We're a podcast brought to you by Joyce House, and we're so happy that you're here today. Caregiver Crossing is a podcast that's created just for you, the caregiver. I'm Tina McIntosh.
I'm Terry Stacy, and we're here every week with experts from across the country to provide comfort and resources and a lot of joy to our caregivers. This podcast really serves to embrace family caregivers of today and tomorrow. So as Tina said, we're so grateful you're here. Let's jump right into it, Tina.
Yeah, today we're talking with Regan Streif research scientist and IU School of Medicine professor of medicine, Christopher Callahan, Dr. Callahan. And he was one of the members of the committee that compiled a report, Meeting the Challenge of Caring for Persons Living with Dementia and Their Care Partners and Caregivers, A Way Forward. And we like to hear that, a way forward. This was sponsored by the National Institute of Health's National Institute on Aging. And the report looked at various needs of people with dementia. Dr. Callahan worked extensively with colleagues at Regan Streif at IU and Eskenazi Health here in Indianapolis on developing and implementing collaborative care models for Alzheimer's disease.
There are between 3.7 million and 5.8 million people living with dementia in the United States. And that number is likely to grow as the population ages. It's scary. And this new report,
it's huge, Terry. I know I'm interrupting you, but that is a huge number. I want people to really think about that.
Yeah.
0.7 million and 5.8 million. We're somewhere in there, people living with dementia in the United States. It's mind blowing.
Yeah, and as I said, I think it's scary. And this new report will details the state of dementia care and research in America and provides guidance on future research to make sure both patients and their families are having their needs met by the care that they receive. Dr. Callahan, we are truly honored to have you here on the show with us today. And before we get started and into that report, talk a little bit about your background and what led you to do this work.
Well, I have been at Indiana University and Eskenazi Health and Regan Streif for about 30 years now. I came here to learn to do research in primary care and to improve the way that we organize our health services. But one of the things that people often overlook is that most people living with dementia receive their care in primary care practices. We tend to think about dementia care coming from specialty physicians like neurologists or geriatric psychiatrists, but there aren't nearly enough of those kind of doctors, and they are not distributed in a way across our country that would be available to most persons living with dementia and their care partners. So long ago, we thought primary care was the place to start doing research in this area. The way I got drawn into geriatrics, though, was the stories. I think that's the way many people get drawn into geriatrics, whether it's from a grandparent or patients. But it's very enjoyable to take care of older adults because they've lived long lives, obviously, and they have great stories and great wisdom. And we simply have a difficult time drawing enough people into the field. And so we really rely on our colleagues in primary care to deliver most of the care for persons living with dementia.
Dr. Callahan, for those of us who've been doing Caregiver Crossing and the listeners who have been with us since we were a radio show into this podcast, it's no surprise that there's so many people who are not experienced, not educated, not connected that are doing the caregiving, right? I mean, I watch it all the times with the families at Joy's House. And I know it's something you and I have been talking about for years. And I feel like all of a sudden now, and maybe COVID had something to do with it, caregivers is a term that people are starting to understand. And so as you dove into this report, and led these efforts, what's come out of it? I'd say one, that you expected to come out of it, and two, what surprised you?
Well, if you think about your work at Joy's House, for many people, it would be viewed as, revolutionary. Like, wow, here is a person that got it way back when. And yet think of all the people that have been helped there and how desperate the need was for some families. And we only have one Joy's House. And we need dozens and dozens and hundreds and thousands of them across the United States. The other part of this is, and it's hard to say without sounding harsh, but we've invested quite a bit in cure, in searching for a cure for dementia. And I certainly want those investments to continue. But one of the things that happened is, caregivers themselves and persons living with dementia themselves said, but we need help now, and we've needed help for 30, 50 years. And so as you're thinking about research that might unfold over the next 10 to 20 years, what are we doing for the people that are living with dementia now? And so that's part of the urgency of the report. And part of what the National Institutes of Aging said is, well, what is it that we know now that we could, put in operation and tell people, yes, this is sound, good care for people living with dementia. And as you know, Tina, 80% of it are home and community-based services. And only a very small part of them are, medications and diagnosing and, diagnostic testing. And I think one of the things that made this surprising was how loud and clear that came through from the caregivers and their, their advocates that we invited to contribute to the report. It's an urgency, and it's listen to us about what we actually need.
Dr. Callahan, let me ask you, if COVID, that this year, and it's still here, but what it has done or how it has changed caregiving?
Well, a couple of things. One is to shed a light on how important caregiving is for so many people. This is sometimes, I think, in the past that even as caregivers, we've not always told people about our burden, that it's something that's, kept in the house and you do because it's your duty or your family responsibility. But one of the things that COVID uncovered was so many millions of people who rely on a family or on a professional caregiver to come into their home or to come into a skilled facility to provide care. And this, of course, goes well beyond dementia. There goes, to the many, many families that are caring for, say, a disabled child, or now maybe a disabled adult, as well as a parent. And so it's very hard to hide that when you say, oh my goodness, this person that I'm providing care for, I'm now potentially a threat to, because I might be bringing COVID into the house. So absolutely a terrible and desperate situation, and one that, really just brought many people to their knees and trying to make these very difficult decisions.
It was looking back on the acute time of COVID, if you will, that crisis time. We watched how many families, like you said, came to their knees. I think that's the best image that I would ever be able to come up with. So I appreciate you saying that. What is coming out of this report that we are saying these are the changes we can make now? Because you make a great point. The research is really for the future, and so many. We just heard millions of people are living with dementia and have primary caregivers typically in their homes. So what have we learned that can be done for caregivers or caregivers can do for themselves at this time?
I wish you weren't the one asking me that question, because if any of your listeners know about Joy's House, well, one of the common sense things that came out of the report was that there are some things that are common sense. And people need care, and it's not coming from robots. it's going to come from other humans, who are capable of connecting on a human level, in a loving and caring environment, but that a single individual, regardless of how much you're dedicated to the care of your loved one, nobody can do anything 24/7. Impossible. And you will eventually break. So one of the key recommendations was that there are obvious caregiving and home and community-based resources that people need to know about, and they need to be better financed. So I bet you weren't expecting.
Can you say that louder for people in the back?
This is part of what we heard from caregivers and persons living with dementia, because some persons living with dementia are just fine on their own, but they need a little bit of help. If you look at the perspective of a program like Medicare, though, the other thing that leadership in Medicare would say is, but that's not in our statute. That's not part of what we're able to support. And so part of what we need is changing in the financing. So these kinds of services that people want and are asking for are paid for as well as some of the traditional Medicare services.
With us today is Dr. Christopher Callahan, Regan Streif, research scientist and IU School of Medicine professor of medicine. And before we let you go, we just have a couple more minutes left. Let's talk about, how can people get their hands on this report, or what happens now that the report is there? What happens next?
Well, this report was requested by the National Institutes on Aging, and you can go to the National Academy's website and you can download this entire report for free. And you can also, if you're thinking, well, I don't want to digest this whole report, it's very readable, and it was written in a way to be approachable by a very wide audience. You could at least download the summary part of it, or you can download individual chapters. So it's out there and it's available. The other part of this that I think was very telling was how diverse the population of older adults with dementia has become. And we don't just mean black and white, but all of the other variations in race and ethnicity and education and resources that are available. So part of what the report is saying is to try to get an individual provider, because imagine that you are one of these primary care providers and you say, what do you want me to do? And part of it is be aware of the home and community-based services in your area. And if you can't be, at least find your area agency on aging or your local Alzheimer's association and refer people to those. But also, one size doesn't fit all. And so you really have to take a tailored approach to what does that family need or that person need. They might not need anyone in the home, but they might need help with transportation and every other variation you can imagine.
I can't wait to get my hands on the report and look at all of it. Dr. Callahan, I feel like every time you and I spend any amount of time together in person or on the phone, I'm always encouraged by you. And I want listeners to feel encouragement too, that this is at the forefront of our minds, not just in the state of Indiana, but nationally. So I appreciate what you've done and what you're doing. I will tell you, you mentioned Joy's House. We do have some things on the horizon that I think you and others are going to want to know about and be a part of, because it is for the immediate needs for caregivers. And just keep the words caregiver way in your mind, because it's coming. And so I do want to talk with you about that offline. But for now, Dr. Callahan, I know that you are a busy man and I appreciate you being here so much. So thank you for that.
Well, thank you very much for having me. And thanks to all of the caregivers out there. If you are not a caregiver and you are not receiving care from a caregiver, you will be doing one of the two or both someday. So I should also say thank you, and everyone should know that Tina is a pioneer.
Thank you.
Yeah, Absolutely. Amen.
Humbling and I feel we're prepared at Joy's House to be a part of the solution for our folks, so who are caregiving and who will be. So thank you. As we close the show today, if you have any questions about this report, about what we're doing at Joy's House, any guests for Caregiver Crossing here, you can email me directly at tina@joyshouse.org. Also, we want to tell you how happy we are that Caregiver Crossing is being supported by our friends at AARP. So they are truly leading a revolution in the way people view and live life after 50. And we're so thrilled they've come on board to support our podcast and so much more. So thank you to them. We love that they're working to empower people to choose how they live as they age. So we'll see you next week here on Caregiver Crossing.